my dears, today's topic is one of those things that autistic people all probably on some level intrinsically know but never really thought about before until they saw like a post or two about this somewhere on Instagram and went, oh, that makes so much sense. Or this video if this is your first interaction with it. But either way, hello, welcome to my little corner of the internet. If you are new here, you're welcome to subscribe or simply vibe, you do you. That was so good and it rhymes. I'm adding that to my intro now. That was so good. Anyway, topic, yes. So today we are going to talk about why traditional talk therapies are kind of ineffective for autistic, ADHD, and other people with neurodevelopmental disorders. However, normally you can't see how much I'm moving my hands because it's down here, so I'm going to keep them down there. Anyway, it can still be effective. I definitely did learn some stuff from my many years of therapy, and in general, you should definitely seek out help. This video is not me saying, hey, therapy doesn't work, don't even bother trying. It's me starting, or rather furthering, a conversation about how if you feel like therapy didn't work for you, you're not defective, and a wider call to the psychologist and therapist and clinician community to figure out how to change the system so that it is more effective for people like me. So again, please seek help. It could work for you. You deserve to not feel awful. But also, if therapy makes you feel more awful and you feel the need to seek out other methods but then can't find any and feel a little hopeless and alone and like you're the only one this experience, that's okay too. We're going to talk about your experiences in this video to the best of my ability because honestly, I am always of the opinion that bad things get infinitely less bad once you have the words to describe them. Also, obviously, I'm not a therapist. I am a 20-year-old psychology and neuroscience student who has done therapy for like half of their life. I should not be your only resource on this topic. I'm just an awkward substitute, I guess, because I don't know any autistic therapists. So take everything that I say with a grain of salt. Thank you. Alrighty, disclaimer complete. Let us talk about therapy. So the plan for today's video is to talk about the major reasons talk therapies can be ineffective for people like me. We're going to touch a little bit on suicidality and self-harm. So content warning for that. I'm going to try to keep it as vague and light and just passing by the topic as humanly possible. But if you do need to skip this one, that is totally valid. And then we're going to talk a little bit about my experiences with therapy, how I handle things, and where to maybe go from here. Also, when I say talk therapies, I will be focusing primarily on IPT and CBT, which are interpersonal psychotherapy and cognitive behavioral therapy, because those are the ones that are most commonly used and also the ones that I personally have experience with. Also, there is a very strong overlap kind of between the two because they both focus on communication, contextualizing thoughts, and trying to change and reframe those thoughts in order to be healthier in a given situation. So the first reason that these therapies tend to fall short for people like me is kind of the most obvious one. People don't get autistic and ADHD people and other people with neurodevelopmental disorders. I mean, we have a completely different communication style, and this has been documented time and time again, that we struggle in conversations with people of a different neurotype because of this. It's called the double empathy problem. It's a heavily documented thing. We have talked about it before. I will link the video up here if you want to learn more. But anyway, so because of this, when I have a conversation with a non-neurodevelopmentally disordered, that category of neurodivergent person, I can't relax. I miss a lot of what's going on, what's being said. I instinctively mask and hold myself back no matter how hard I try not to. And overall, my social skills are more bad. Don't get me wrong, I am so good at masking, and I really enjoy conversations with neurotypical people, but that kind of interaction is meant for your teachers, or your cousins, or people in your classes, not your therapist. You should be able to have free-flowing, comfy communication with your therapist and not feel exhausted by the social demands of that interaction. And also should kind of understand what they're saying. That helps. The amount of neurotypical therapists I've had who speak almost exclusively in metaphor because they think that helps is really far too many. But anyway, so this means that for people like me, we need to have a therapist that is either like us or really darn good in our style of communication, which usually means they're like us, they just don't know. But due to the accessibility of this field, people like me don't really become therapists very often. Or if they do, they're likely undiagnosed and therefore wouldn't have any idea that they're an ideal therapist for people with neurodevelopmental disorders, so they wouldn't be advertised as such and therefore are near impossible to find. And in general, very few people specialize in working with people like me, not to mention that a solid amount of those people say that they specialize in it and then have really problematic, ableist, paternalistic, gross views of these conditions that kind of make them the worst people to open up to about it. So That's rough. But it's also important to mention that a lot of autistic people who go to therapy don't know that they're autistic to begin with. They go instead because they've suddenly hit burnout. Their anxiety and their depression or general level of just overwhelm has gotten kind of untenable, so they're reaching for outside help, which is great. But then the therapists say, oh, you have depression, or oh, you need exposure therapy, rather than recognizing clear autistic burnout, which has completely opposite treatments. It's literally to like take a break. But that means that you end up just getting worse while being told over and over and over again that you're actually healing, which can be very confusing and it's not very fun. They can also mistake struggles with perspective taking as a personality disorder or complete lack of empathy. They can see frustration and shame at executive functioning issues as pathological demand avoidance, or call the stimming or other sensory things you do to healthily regulate as some form of OCD or self-injurious behaviors that need to be minimized and fixed. And I don't really blame therapists for this because I've been in some abnormal psych classes, and based on how much of this field like worships the DSM and forgets about the actual humans behind the diagnoses within that book, if I finished school and were suddenly, a therapist, I would probably come to the same conclusions without this lived experience. Because first of all, if you're not a cis white boy who likes trains, you're not autistic and shouldn't even be considered as an option for autism. Obviously, I'm being sarcastic, that's sarcasm. But anyway, our education system is a hot mess and it's kind of creating this problem. And I've ranted about this several times before, but one specifically is in this video over here. If you're an educator, please watch it, please share it. I worked way too hard on it and it took a lot of emotional energy, so yes. But that kind of is the first group of reasons as to why talk therapy is a struggle bus for people with neurodevelopmental disorders. The second is that on top of communicating differently, we also think differently. Obviously, that makes logical sense. But it also means that talk therapies, organized for neurotypical brains and communication styles, are missing crucial pieces for how our brains work. For example, let's talk cognitive behavioral therapy. So the way that this therapy works is by identifying problematic thinking patterns and patterns of behavior and learning how to take them and reframe those thoughts and actions into something that's more productive, into more productive thoughts and actions, a practice that is widely successful in helping with mental disorders. Because obviously, if you have a piano recital and you mess up one note but get everything else perfect and that one wrong note triggers a panic attack, that's not the most rational or reasonable response to that negative thing, and that can get debilitating over time if it continues that way. But the way that CBT works in that situation would be having you identify the emotion, identify how that emotion is inflated given the situation. I'm pretty sure this situation would be labeled as an example of catastrophizing, and then regulate that emotion, which on the surface looks super great, and that's a great way to deal with things. However, it's important to keep in mind that half of autistic people report having alexithymia, or difficulty in identifying and describing feelings and in distinguishing those feelings from bodily sensations of emotional arousal, which means that some of those middle steps, i.e. identifying the emotion and then identifying how it's inflated, are virtually impossible because we don't have that skill, which means that we don't get to the regulating bit, we're just stuck on the first assignment. And a lot of therapies work this way. The first step is to recognize and report your mood or emotions. And am I halfway decent at that sometimes now? Absolutely, I totally am, but you know when I'm really terrible at it? Oh, all the times that I actually need to be good at it when I'm in crisis mode? Yeah, I have the handy dandy feel wheel, which kind of helps, but even when I use this tool to try to name my emotions, I often come up with like 6 different options of what it could be. Maybe. And that's also not quite helpful because in general, coping skills for a very anxious person and a very depressed person are often the opposite. And then when you throw in the whole disability aspect of sometimes not having the ability to do the things that I need to cope, or just general brain fog making this process worse because I can't think, we have an issue. Now, for me, I've learned my own way around this naturally. I solve the problem at hand. I give myself time to process because as an autistic person, it takes me a really, really long time to fully process things. And then later on, I figure out how to describe what happened specifically in order to learn from that situation. For example, in the piano situation, I would have had the panic attack from the wrong note, and then I would have handled that panic attack, self-regulated, taken some time to relax, and then gone, okay, so what triggered that and how can I manage that in the future? When in my experience with CBT, the therapists want you to do that in real time while you're like it's part of the crisis management thing. You're supposed to regulate the emotions by trying to figure out what they are. That's kind of how CBT works. But for me, doing that on its own is daunting and overwhelming, and just as much as the actual situation at hand. Like the amount of times that I've been told to just park it or put your thoughts in a box on the top shelf and walk away, followed by like deep breathing exercises. is far too many for somebody who struggles with metaphors. If you tell me to stop thinking about a thing, I'm going to hyperfixate on the thing, and also my executive functioning is trash. I know I need to breathe deeply. That's not happening because I can't make myself do it, which then makes me hate myself, which makes the cycle worse. Another tactic I learned that people really like to use for me is the what's the worst that could happen thing. Because in theory, by thinking about what the worst thing is that could happen, you realize that it's not actually the worst thing and that you would survive that. In the piano example, you played a wrong note. What's the worst that could happen? Well, the average human would be like, well, people will notice I messed up, but we all make mistakes, they'll get over it and they'll move on. Or that would be followed by some sort of other counter thought, like, they probably won't remember that in comparison to the rest of the 5-minute piece that I played absolutely perfectly. And then, bam, emotion is regulated, short feeling of sadness is gone, let's move on. But for me, my brain goes, they've noticed I've messed up, and because I'm so ashamed of messed up, they must also feel the same shame and awkwardness thing that I'm feeling, and so now I'm really embarrassed and I want to hide from everybody forever, and now it's awkward, and now they're all going to think that I'm a bad piano player because, well, now I think that I'm a bad piano player, and then I could get teased for it, which I can't handle right now, and then maybe I won't have any friends. And that's just a whole spiral of anxiety because guess what? Issues with perspective taking are a fundamental part of neurodevelopmental disorders. I can't tell you what other people are thinking, but this thought pattern, this is textbook catastrophizing and should be mitigated with a basic, that probably won't happen, or if it does, not too bad, those kind of things. But as somebody whose diagnoses literally involve the sentence rigid thinking patterns, the idea of having to challenge my thoughts and beliefs is really terrifying. Like, these regulation techniques assume that I have some sort of flexibility in the way that I think and therefore can be taught alternative strategies for interpreting situations and information. And here's the deal. I've worked really, really hard on my mental flexibility. I've gotten really quite good at it. And in therapy, I'm a model student. I would be getting an A+ at CBT. Definitely, if that existed. And it doesn't, but I want it to, just for my, anyway. But then when it comes to the moments where I actually need to use it, when I'm in crisis mode, the ones where I'm like overwhelmed and shutting down and inevitably reverting back to the old habits as a method of coping in comfort, because that's what we do. The whole mental flexibility thing is so very much not happening. Like, I know what I'm supposed to do. I'm good at it when I practice it. But then when I'm in the actual situation and then I get into survival mode, my brain can no longer think those things and we are right back to regular survival mode without any of the extra stuff on top, which on some level is completely normal. This is why we teach the parents of children going through CBT about what the child is learning so that in a situation, the parent can help coach the child through it until at some point they're able to do it independently themselves. Because the idea of CBT is to get you to be able to cope with yourself. It makes sense. It totally does. But also keep in mind that mental flexibility is not happening in my brain when I'm overwhelmed and shutting down. It's just not. And then if somebody else tells me those things to try to help me with that mental flexibility, like, for example, if I was having a panic attack after the piano recital and my mom came up and said, hey, you're just catastrophizing. Let's think about all the things that we did well. Or the dreaded, take a deep breath. What's the worst thing that could possibly happen? Which not only annoys me because it takes so much extra energy and effort to listen to somebody when I am in crisis because my auditory processing is poop, but also because A, I can't name my thoughts even if you ask me, B, why does that matter? And C, this reminds me about how I can't do that. So now on top of feeling stupid for messing up the note that I'm panicking about, I also feel stupid because I can't do a basic thinking exercise to help myself. What is wrong with me? I'm ineffective. And my crisis is now infinitely worse, when it could have instead been solved with me removing myself from the situation, having nice sensory input for a while so I can cool down and then process the situation and handle it on my own. Because much like an overheating laptop, the processor doesn't start to work until the fans have cooled it down. Now, the last and most important thing to discuss here, however, is the idea of irrational thoughts. Talk therapies put a lot of focus on identifying irrational thoughts and reframing them. In the piano example, which I promise will kill pretty soon, my brain could go, I messed up the note, therefore people are going to laugh at me, therefore people will bully me, and I'm not going to have any friends anymore. And that, on the surface, does feel irrational, right? But then for an autistic person, that instance of messing up one note could be similar to that time a year before when they had to read out loud in front of a class and pronounced a word wrong because, they don't talk a lot and they just read. And, because people like to use any excuse to tease the weird kid, they got endlessly bullied and didn't have any friends. So to neurotypical people, that seems unrealistic, but for autistic people, that fear is very real and genuine and often entirely reasonable and based on fact. I mean, keep in mind that there is no untraumatized autistic. Our inflated responses to things are how our brain and body try to cope with a world that's always trying to hurt us. So the idea of, if I say the wrong thing, I'll lose my job and wind up on the street, that's not as irrational as one may think, because it is rooted either in genuine personal experience or in the genuine experiences of other people within our community or stories that we've heard or seen. And being told that your social anxiety is catastrophizing may make sense from an outside perspective, but from the person experiencing it, their data of the entire world suggests that social stuff almost always goes badly for them. So of course they're going to be anxious about it. That's only logical and reasonable. And it means that you're being taught that your own thoughts and feelings are wrong yet again, and you keep putting yourself in dangerous situations because, well, what you're feeling is inherently wrong, which is not at all true, but is what tends to come across. Autistic people tend to be pretty rational and overanalyze everything. We don't need our therapies to train us to analyze our emotions and stop being ruled by them. In fact, the biggest issue for autistic people is how much we have been told to just ignore our emotions. We're always taught that what we're feeling is irrational. We're always ignored and not listened to. So talk therapy is effectively a doctor furthering that narrative and saying it's your fault that you think this way, rather than acknowledging that the world just isn't kind to us and isn't accessible. And we don't need more of that. The world does that for us anyway, for free. It's great. Not to mention that insurance usually only funds watered down versions of IPT and CBT, which means that even neurotypicals also often don't benefit from it because it's not the real thing. But the biggest issue with this is the impact of it all. As I said earlier, a lot of autistic people who go to therapy don't know they're autistic and instead go because they have hit burnout and suddenly their anxiety or their depression or general level of overwhelm has gotten pretty much untenable and uncopable. That's a word now. Now, in our world, we see therapy kind of as a last result, unfortunately. When we feel unsafe and hopeless, that's when we ultimately decide to go seek help. And if you see therapy as the last resort, the final hope that maybe they could help you to feel better again when you're really struggling, but then it teaches you that your thoughts are irrational and you don't feel safe or comfortable in the therapist's office, that's it. Like, that's the end of the road. You don't see any other ways out. If that doesn't fix you, what is going to? And that's why it's so crucial that the system gets itself together as soon as humanly possible, because we're losing lives every day due to therapists who aren't trained or able to do the job that they need to in order to save us from feeling that hopelessness. A lot of focus has been not on the therapy itself, but on more of the what's wrong with us and why are we all depressed? And that's an important aspect of the conversation. It's a very valid question to ask, but the answer is pretty obvious for any of us involved. No matter what you try to do to prevent suicide from a therapy angle, the world is still going to keep making it very, very clear that we are not welcome here. They're happily going to put neurodivergent people on the involuntary do not resuscitate lists when triaging. They'll talk about how happy they are that the pandemic is only killing disabled people because they were sick anyway, so why does it matter? And continue to tell us over and over and over again that our response to this, our desire to not be alive, is our fault, and that we're having overinflated and unreasonable thoughts, even though we're just naturally responding to the world's hatred of us completely and totally rationally. And also continuously telling us that our oppression is our fault and our feelings about that oppression are our fault and we need to go to therapy to fix them is active violence and contributing greatly to our suicidality. However, I don't think that all hope is lost, because the fact that I feel safe enough to film this conversation and put it on the internet, the fact that this is not the only version of this conversation I've come across that has come out recently, the fact that our community has gotten so much bigger so quickly and that this movement has moved so far and so quickly just in the last couple of years really does give me hope for the near future. For me, therapy has always been rough. I still go once a month, though that's kind of only so I can get the meds that I need, but whatever. I mean, for me, it's literally just I pay a couple $100 to relive all of my trauma from the last month that I've already learned and moved on from and kind of forgotten about, and then have my therapist tell me that they're proud of me. So it doesn't really feel productive. It's kind of performative for me at this point on some level. But I've done extensive cognitive behavioral therapy followed by IPT for about 6 years of my life, and I found that some things have gotten a lot better, and I've discovered that I typically know steps 1 and 3 of a process, but not step 2, when the point is to be taught steps 1 and 3. And that's kind of been my experience for all kinds of education for my whole life. So I'm pretty good at figuring out what the goal of the thing is and then teaching myself around it to make it accessible for myself. So honestly, I don't know how much of the skills I've learned have been directly from what they're trying to teach and how they teach it in therapy, or just becoming a psychology nerd of my own. But I do know that in general, I know what the solutions are and I'm able to find them, and I know what I'm supposed to do in situations. The issue is that I can't usually do those things when I need to do the thing. Because I know like, oh, when I'm very anxious, I need to do this thing. But can I tell when I'm anxious? Not often. Or I can tell, but then I can't make myself do it because executive dysfunction. So vibes are not great. Obviously, I'm not endorsing you to not go to therapy. Please at least give it a try. It could really work for you, and there are some good specialists out there, and I know it's very common to do a therapist shopping thing and try several therapists to try to find a good fit, which I highly, highly recommend. I'm going to be honest, I personally have not done that because I had a very traumatic therapy experience in the 4th grade, which made me pretty therapy averse for about 6-ish years. So I had to figure out how to work my way around it. And by the time I started therapy again, because I really needed to, I was pretty stuck in my ways because I'm that way. So it's not just a thing I have to do to make sure that I'm on the right track and that I'm handling things with myself properly. They just basically say, you're killing it. It's dysfunctional, we know this, I'm a bad role model, I'm really sorry. But in the sense of, you're not defective if therapy doesn't work for you, I am the perfect example of that. And you can be mentally well if therapy doesn't work for you. If you're in a similar situation, know that things do get better for you. I absolutely promise. This conversation, as I said, is very recent and very new, and I do think that a lot of good things are going to come out of it in the near future. Also, there are some great therapists out there. You just gotta shop around to find one that's right for you. I know that I personally am afraid of hurting people's feelings, so I kind of feel the need to stick to one after the first appointment. You don't need to do that. Therapists very much expect you to shop around, and they don't mind if you only ever have one appointment with them. And if you're really nervous about therapy, whether that's about what it may look like or how they might feel about things or what might be covered, obviously YouTube is not a substitute for therapy at all, but for me, honestly, channels like Cinema Therapy and Mickey Atkins have helped me to kind of learn through conversations about other situations, so it feels a little bit safer, and it's a really great first step to getting yourself to going to therapy. I will link those guys in the description for you. Also, obviously the autism community has tons of resources on how we regulate, how we handle situations, and whether you're autistic or not, they may still be really helpful for you, so you can definitely check those out. And the last thing on this topic, which I intend to make a full video about at some point, but I don't have the emotional space to talk about this in thoroughness, is that people from the outside often see certain stims as self-injurious behaviors, even when they're not necessarily. I'm not saying that self-injurious stims don't exist, because they very much do, but I am saying that there is a lot of shame around both stimming, obviously, and self-injurious behaviors. But you can't effectively identify those behaviors and redirect your behaviors or learn new ways to channel that if you are really ashamed of it. And I, for one, used to have a lot of shame as to why I was doing self-harming behaviors, because at the times I was like, I don't want to die, so what's wrong with me? Am I some kind of heartless, pain-loving weirdo? But then I learned that the majority of those things are just sensory-seeking behaviors, and I learned to channel them into other things. For example, my go-to when I'm sensory-seeking and would normally like dig my nails into my skin or something like that, I grab a string instrument and I play and I sing and I rock back and forth, because that's sensory input by way of like 4 different methods, and it really helps me to regulate a good deal without accompanying shame or injuring myself by accident. So hopefully that helps you to reframe that a little bit in order to make life a little bit better for yourself, hopefully. And for allies who are watching this video and want to know what they can do, hi, hello, thank you so much for being here. It means a lot. You're such a great ally, 10 out of 10. But honestly, the most important thing right now is to work on the creation of community-based post-diagnostic support, having clinicians work with an intersectional and social model of disability, have less deficit-based diagnostic criteria, dang it, and include accessibility and accommodations in every space. And I'm not talking just clinically with that one, I mean like every space, including the workplace and your home and schools and everywhere else, because every time that I've had a really scary mental health crisis has been the direct result of me being discriminated against enough that I no longer feel safe in a space that I'm supposed to be in frequently, and that chronic stress of having to be there frequently makes me physically ill every single time, without fail. And usually that also includes me reporting it to somebody in charge several times and not being listened to, which then makes me feel completely hopeless and worthless, and I, don't do very well. So basically, be a decent human being. Know that people think differently than you do, and that it's normal, and it's okay, and that our study of psychology and clinical practice of that psychology really needs to reflect that, because right now lives are at stake and nothing is really being done about it. But anyway, as always, thank you for listening. Thank you for learning. Remember, it is never too late to start over, and I look forward to seeing you, my dear, in the next one.